Welcome to the Transforming Healthcare Coaching Podcast, where we bring you guidance and coaching perspectives so that you can level up in your life and work. We believe that everyone in healthcare deserves a coach, and that together we can transform healthcare one person at a time. My name is Lillian Liang Emlet. I'm the founder and CEO. We have a team of coaches from many disciplines that are all trained in energy leadership coaching, and that we are able to help clinicians in healthcare with a wide variety of niche specializations, including well-being, performance, career transition, executive leadership, and team and group coaching. All of us are currently still working in healthcare or previously worked in healthcare. So that with our coaches, we understand what you're going through day in, day out. And all of us are available for one-on-one coaching in addition to the group and the team. And so I am super excited to have Dr. Isabella Fugaccia with us today. She is a CEO of Dr. Isabella Fugaccia Management and Leadership Consulting. She's an executive coach, team coach, many other things. And so I will actually turn it over to you, Isabella, so that you can introduce yourselves to us.
Well, thank you, Lillian, so much for inviting me, and hello to everyone on the line today. I look forward to hearing from you and your questions and any insights you'd like to share. I'm looking forward to those. Lillian mentioned understanding your perspective, and in that sense, I'm including everyone who is a healthcare worker and also a broader perspective. So people who are involved in the healthcare industry, so life sciences industries. And so that's a lot of people there. And it certainly reflects my background as a clinical pharmacist and specialized in neuroscience. And my connection, other than the research, is with the healthcare community. Is at this point, I've worked with over 10,000 people in healthcare in a training and coaching capacity. And for me, what that means is deep diving into each and every person's specific needs and objectives. So I have my own specialty areas, of course, and it's very much a matter of gaining the perspective and understanding what the needs of the person, the team, or the organization are. And I try to do that as fast as possible. So I've really learned about so many roles, whether it's from physicians, nurses, tech, other pharmacists as myself throughout the years. And I very much enjoy that.
That's amazing. So I am super fascinated. When your company is contracted to work with a large healthcare organization, what are the most common reasons that happen?
Great question. So we work globally, primarily in North America and throughout Europe. We also work with global teams, and that means cross functional teams. And as unique as some of the aspects are, really everyone in healthcare is working in a very complex yet a wonderful ecosystem. Okay. I see it as we're all working in medicine. And because of that experience, what we're very good at not making assumptions. And we're very good at not generalizing issues. And so we're very good at listening for those real issues, listening for the dreams, reading between the lines. So when any organization contacts us, we always do one thing first: we listen. And for any coaches on the line, we listen in a very particular way, and that is without judgment and without immediately dashing ahead towards solutions or cures to whatever we're hearing. So you'll know as coaches how important this is. And as we're listening, many times the organization actually thinks it knows what the objectives or goals are, but It turns out that sometimes they're right, and many times, though, they're not quite aligned with what people really need, or they don't have the clarity around what people really need and want. And just like in healthcare, where we always want to find a root cause of a patient's conditions, right? We don't want to treat only the symptoms, as important as that may be. We want to get to the heart of the matter. We train so that we can be very efficient. We can have the largest impact and have lasting change through and in helping people develop. So whether that is working with people who have been in their roles or in the workplace for many years, people who are just joining the workforce, and everyone in between, really. So the topics that we specialize in are what are called adaptive skills. And that seems like a broad topic. It is. In fact, that our specialty is adaptive leadership. And within that, we find skill sets that include listening, applying critical thinking, decision making, increasing self awareness and self management. Of course, that also includes communication and presentation skills. It also includes asking great questions. So we help people really develop their capacity to ask better and better questions. And it's all around really growing people's resilience, helping them grow their resilience and innovating themselves. So those are the areas we specialize in.
I love that. It's so funny how in the speed of the running of healthcare organizations and maintaining the quality and just doing the day in, day out, that leaders and mid-level managers often don't take the time to pause and truly listen deeply. And what I'm hearing you say is that just really taking that dedicated time for your organization, your team, your structures to cross-pollinate and hear either from the front lines or from each other, just take stock of where they are is really important, and that investing in the organization is something that they contract with you so that they can actually do the work and make sure that everything stays healthy. So almost like preventative medicine for the organization.
Exactly, Lillian. That is, it's preventing, it's mitigating, it's solving at any given point and time frame.
Yeah. So I'm curious, when you start to work with these teams, departments, or divisions that you're given, how do you actually get to the root of sort of the issues? Because I can only imagine what it must be like in terms of gaining the trust of anywhere from 20 to 100 people at any given time. And the time frames may be challenging for what they propose in order to get to the root of their issues internally. What things do you tend to do in groups that help people hear each other better?
Again, it's back to listening. And not only do we want to emulate those skills, but we find that it's really the effective approach. And so listening is number one. And we follow our system, which is a very dynamic system with very clear intent. And clients know us for how we execute those intents. Again, getting to the heart of the matter faster and better is our mantra. So, in the sense that while organizations and, of course, individuals want to develop and learn and do that in a very efficient as well as effective manner, we have to be mindful of what their specific interests are at any given moment, whether we're working with an individual, a team, or a group of people. Again, it's the listening part that starts way before we actually start the work with, let's say, the team. And it continues throughout. So that way we can be flexible and adaptable to people's needs. And then it continues. So it doesn't stop there because it continues after the engagement since we're very interested in lasting learning and because the impacts of learning and development are so far reaching. It's like the ripple effect. And there's that listening part. And how many times have we also heard we need to be true to ourselves, right? Our interpretation of that is we also need to ensure we align to our values and commitments. Of course, we are very service minded. We want and love helping people. Okay. And we want to achieve that lasting behavioral change. Okay. So it's not just a 24-hour effect. We're looking everything we do and everything we train for as well is with that intent for lasting learning and lasting behavioral change. So that is so important to us because we see it as we are accelerating the time to learn and develop. It's also important that we honor the effort for learning and change. And Lillian, you said there's such a rush, right? Start fast, finished fast. Okay. And one of my jobs is also to have those tough conversations with organizations and the conversations around is this really feasible? Are the goals and objectives challenging, but are they feasible? Okay. And so I have to say, over the years, I certainly enjoy those conversations, but it's very important in us to honor that effort. It's even part of our motto. It's time for change for people. It's something that we really value and believe in. And then, of course, there's the aspect of the robust measurement. So, how are we measuring? And more importantly, how are we pushing forwards? How are we moving forwards? How we are measuring learning and how we are measuring change. If we in the industry and our clients and professionals themselves, if we're not moving that needle forward, who's going to do that? Okay. These are all again, our values as we meet with people and then, of course, when we start working with them.
I love that. Just in all the things that you just shared with us made me really think a lot about, well, how could we have trust and authenticity with our colleagues at work? And some colleagues, like you said, they're global that we actually don't really know from an interpersonal perspective. So I think the inclusion and feeling welcome, even for leaders as an organization, and being vulnerable is a challenging thing, oftentimes since the pandemic, just because of having to work in such large, diverse teams that we actually do come from different perspectives, and it's hard to honor all of them at the same time in sometimes in large groups. And I think also what I really loved what you talked about too was just knowing your values and making sure that every leader, every person in the organization carries the values together, because that's actually what it ends up happening in most cultures of organization. It's the values of all the people who make that up and how they can best execute together that keeps people going. Like, at some point, you can find some harmony when you get a room of people, even if they're just very different politically, very different skill wise. At the end of the day, they tend to at least solidify around some kind of vision and mission for the group that they're leading.
That's right, Lillian. And in your invitation, where you mentioned exploring how coaching helps the process of organizational culture change. So we have to see it as this cycle of every single thing that you're thinking about, every single thing that you're doing every day is contributing to the culture of your own culture, of course, but the culture of your organization. And then, of course, working in that organization, you're absorbing that. You're living inside an ecosystem, as it were, of cultures and values. So it's very important to curate what we put in, right? And to contribute to making our organizations the best that they can be.
Yeah, and I think what's also, pretty amazing is the fact that sometimes it just takes a new person or someone who's willing to be brave and vulnerable and state what everybody else is thinking inside their head in terms of there's an issue with either how we're showing up for each other or how we're covering each other as a group. What's really actually important, especially in our personal lives, because we don't just leave our personal lives, completely at home even when we show up to work, that how we can actually best support each other may change over time. And having someone being vulnerable enough to actually tell everyone that we might need to rethink our tradition, age, old, generationally. This is just not how we do things in this group. Sometimes it's nice to have that brave soul who actually makes us all think outside the box. And like you said, then we become more adaptive, more expansive, and that we can actually show up more creatively to figure out what needs to happen. We saw that in the pandemic.
Absolutely. And we definitely there was a magnifying glass there, right? The reality is we saw it before and we're seeing it now. And you mentioned the new person. I completely agree. So if you're joining a new team or building a new team, joining a different organization and you're in your transition period or thinking about transitioning to a new organization. The other is in terms of showing up is how can we here's a coaching question. So how can we invent and reinvent ourselves so that even in the same role, even in the same team and organization, that we show up differently? So what's one thing, a small thing that we can do to reinvent ourselves?
That's a wonderful question. Just makes you think too. I've been with the same organization for over 15 years. And, until you really sit and think about how those transitions occurred, that there's opportunities were there and those conversations were there. Sometimes you fall into them, sometimes it's serendipitous, sometimes it's strategic. We've shared maybe a different perspective or what they've seen in terms of reinventing their careers in different organizations in healthcare. I want to also ask if you had to give any kind of advice, having now worked with over 10,000 individuals in teams and organizations, what advice would you impart for current new frontline clinicians and professionals in healthcare as they work in their organizations?
Why don't we start with learn and learn? I know that there's such a focus and we hear that a lot, but ultimately we know, and for anyone who's familiar or has heard about the growth mindset, and in any case, for anyone who's listened to their grandmothers, who certainly many of whom encouraged us to keep learning throughout life. So that would be a fundamental piece of advice. And connected to that is certainly about communication. Interestingly, the World Economic Forum a few years ago published the top 10 skills of 2025. Only 2 of those 10 top skills were related to technology. The remaining 8 out of the 10 skills were related to learning, okay, thinking, problem solving, leadership, being creative, resilient, reasoning. So I don't see that as a coincidence, right? So these are, let's say, the skills of tomorrow that we're really bringing into our daily lives. And those are important. The reason I say communicate is because of the need for connection. So it helps us when we communicate with others. We're really communicating with ourselves. So we're connecting inside ourselves. We're communicating with other people, connecting with other people so we can collaborate with them and exchange ideas also very efficiently. Again, getting back to the speed of the pace of healthcare, right? Sometimes we can ponder questions for hours, okay, days. Other times we have to be able to do that within seconds. And we have to be able to communicate very clearly what the course of action could be or is. So the other aspect is communicating on a broader scale. So, still keeping in mind, maybe going beyond your team. Within the organization, there are so many resources that have yet to be discovered. One thing, Lillian, you mentioned the pandemic, and one thing people have told us repeatedly since then has been how they have discovered how so many people within their organization had skills that they didn't even know about. And it took the pandemic, let's say, to discover these skills and different mindset, offering a richness that I think so many teams and individuals are certainly benefiting from these days.
That's a really great advice to learn. I often, at orientation, I talk about growth mindset. It's always amazing to me that thankfully over time, a few more people seem to have heard that theory. But that I also reassure them too that learning can sometimes feel a little icky, and that's actually okay. To also just realize we're all always learning. And the faster we learn, the faster we try and fail, the faster we actually get better at anything. And that we've lost to some degree the joy of what it was like to just to jump in a puddle when we're little and you just learn what it's like to play in the rain. Is can we all make work the same? Can we bring that same kind of joy to work and playfulness and curiosity for each other? And like you said, to discover each other's strengths, augment each other, and try it out for ourselves.
Oh, sure. There's so many possibilities, and I think it's always a matter of connecting with ourselves in different ways. What are your strengths today? This is going beyond many of the formal measurements. What do you feel like you really know? How are those capabilities tied to the smaller, the daily goals, as well as the bigger goals, the life goals, as well as career goals? And how can we look at ourselves also through the eyes of other people? And that's where the interaction and exchange, and as you said, sometimes that gets quite challenging, doesn't it? But we have to remember, if we're human, fundamentally, we thrive on those challenges. We thrive on solving and issues. We thrive on thinking about and managing dilemmas, whether clinical or not. So, since we're ending today with the advice, is also my encouragement to everyone to bring more of that to work.
Yeah, I love that. That's a wonderful way to end. So through learning, that we're able to find the opportunities to actually help solve things for other folks and patients. So I just want to offer you an opportunity. How can people connect with you and your company?
Oh, sure. You could reach out through LinkedIn. At the moment, I'm the only Isabella Fugaccia on LinkedIn, so I'm pretty easy to find. I would absolutely love to connect and have a chat with you. Reach out so we can have a chat. And I'd really like to learn more about where you're going and maybe how we can work together and explore some different options. So you're welcome to reach out on LinkedIn. You can also reach out via my website, which is www.isabellafugaccia.com. I look forward to hearing from you.
Thank you so much for listening to the Transforming Healthcare Coaching Podcast. If you found this episode interesting or useful, please share this with your friends and colleagues in healthcare. And we will love it if you hit subscribe so that you never miss an episode. Leave us a review on wherever you are listening to us. It means a lot to us, and we actually read every comment. Also, we want to help with the topics and problems that you want us to talk about. Email us with suggestions, feedback, and praise at podcast@transforminghealthcarecoaching.com. If you want deeper support for your life and work as a healthcare clinician and leader, head over to transforminghealthcarecoaching.com and see how we can partner together to meet your goals. Download your copy of our free 5 reflection questions to jumpstart your journey as you level up in your life and work, and get on our email list. Be the first to know about our coaching programs and what's coming. Together, we can transform healthcare, one person at a time.